Hello and welcome to Heads Up, a year-long mental health awareness journey, Dartmouth Health's webinar series focusing on important mental health topics that affect all of us. I'm Audra Burns and your moderator for this series. Today we will discuss youth mental health concerns and ways adults can offer acceptance and support. So joining me today, I have three great panelists. First, we have Kay Jankowski. She is the Director of Psychology Services at Dartmouth Health and an Associate Professor of Psychiatry at Geisel School of Medicine at Dartmouth. Hi, Kay.
Hi, thanks for having me.
Next, we have Fern Seiden. She is the Director of Student Wellness for the Merrimack, New Hampshire School District. Hi, Fern.
Hello.
And we have Natalie McLaughlin-Ray. She is a 10th grade student at the Academy of Science of Design in Nashua and also a Girls Inc. representative. So great to have you, Natalie. Hi.
Hi, it's good to be here.
Thank you all for joining me on this very important discussion. And I'd like to start with Natalie. So let's talk about what are things that you would say are the biggest mental health challenges and concerns that you and your peers are dealing with day to day?
It's kind of hard to have an exact answer to that question, as there are so many different struggles that myself and my peers are facing. Some of the biggest concerns and challenges that I've had to deal with include with anxiety, social phobias, and loneliness. Anxiety and social phobias are something that I've always struggled with, but I think most people will agree with me when I say that COVID has increased, or it made it harder to cope with during the aftermath of the pandemic. Falling out of touch with peers for so long, it gets harder to reconnect, and I find myself being more withdrawn than before. And in the long run, this causes more problems because I feel so isolated that it makes it harder to ask for help.
Natalie, thank you so much for sharing that. You truly are sharing what so many kids are experiencing, and I'm just so proud that you have the strength to be able to vocalize this, because this ultimately is what we're trying to do with the Heads Up series, to empower people and youth and teens to be able to speak up. So truly, thank you for sharing that. And this leads us right into our next, expert, who's Fern from the Merrimack School District. So Fern, your role as the Director of Student Wellness, what are your thoughts and concerns on what Natalie just raised? And are you seeing similar issues and concerns among children in your school system?
Absolutely. Natalie's response, I agree. Just thank you so much for your candid and honest response to that question. It's, prior to the pandemic, we were seeing a lot of mental health issues really impacting the ability of students to learn in school. And since that time, this social anxiety, these concerns about loneliness and disconnection, that just really resonated with what we're seeing here. So, in many ways, what we're seeing is that we are seeing more dysregulation, more ability to cope with just the regular everyday demands of school. So just school attendance, for instance, or being able to stay in the classroom or deal with the kind of stressors that school has and puts in front of students. So we really are trying to develop capacity in our district to manage that. And I think the role of Director of Student Wellness is a response to that. It was established in order to really acknowledge that these issues are front and central and something we really have to address for our students so that they can be successful. We have to break down those barriers to access to supports, and we have to increase the capacity of educators, families, our whole community to respond to what students are feeling and what is happening for them right now.
Mm-hmm. That's so true. And I'm also a Merrimack resident who has two children in your school district. And I just applaud the school district for providing a role like this for you to be able to address it. And I hope that if there's other school systems who might be watching this, who don't have a role like this, might be able to reach out to your district or to yourself and learn more about it, because it is crucial. And it's wonderful that we have your position within our district. So Kay, you can offer a different perspective. So how has the experience of the pandemic affected school-age children about their mental health?
Sure. So, a lot of kids and teens are really struggling right now with mental health concerns. And really, we're seeing that nationally, those trends nationally, and we're seeing it within the state, within Northern New England as well in our region. And I think, it was a problem before the pandemic. So we knew that kind of the rates of anxiety and depression and kind of exposure to trauma has been on the rise with kids and teens. And then I think with the pandemic, it just kind of, it just worsened the problem. So we just have more and more, and we have fewer and fewer resources, unfortunately, mental health providers that are available to see these kids. And the other point that I would make is, I think that the role of stigma. So we still, unfortunately, in our society have a great deal of stigma around mental health. And so I think not only do we have a lot of kids and teens who are suffering and struggling with these issues, but they also feel bad about themselves, or feel like, there's something wrong with them if they come forward to ask for help and to let people know that they are struggling. So unfortunately, that kind of makes the situation even worse.
Mm-hmm. Yep, that's right. And I, you're speaking about the stigma part, and I think it's almost on the part of the parent side too. It's like when their kids do come forward, it's like they don't know if they're comfortable enough to even reach out themselves to support their kid, because there's still that barrier that we got to break, that we want everyone to be comfortable talking about it. And the more we can talk about it, like you said, we don't have as many resources as we need, but if more people are talking about it, hopefully that would change. And we do have a list of really great resources that we know are available listed on our website that all of you can see on your screen right now. Natalie, you offer such a unique perspective. So can you share with us how adults and parents and teachers and maybe other students, how can we help you and your peers when you're experiencing the worry, the anxiety, and the other issues that you described? How can we help you?
Well, as Kay brought out, it can be really hard for us as teens to ask adults for help, and it doesn't really put us in the most comfortable situation. It would be really helpful if the adults understood that and tried to put aside the time to actively listen to the situation at hand, and not only listen to us when we tell it to them, but also check back in. It's not something like, if we have a problem, it's not something that can be necessarily gone or fixed in one day. It will take time, and the healing process, it takes time. So if check-ins were established, that would be very helpful.
That's such a great point, that we have to not only listen the first time they bring up a concern, we need to continue to listen and do those check-ins. So thank you for sharing that, Natalie. Fern, in your school district, and maybe others, supporting students around mental health and well-being, how are you doing that? And how has this changed from before the pandemic?
Well, interestingly, because as we've talked about, the mental health concerns have been on the rise for quite some time. So our district started really looking at this way back in 2015. And so when the pandemic hit, we had already been spending some time focusing on, for instance, the importance of relationships and the importance of developing school climates or classroom cultures in which help seeking was normed, and that we could start talking really about our feelings and talk just really a focus on the whole child in terms of who's sitting in front of you and how can we respond to our students in a really proactive, preventative way. So that we've been doing a long time, but certainly the pandemic has kind of pushed us forward in really seeing the essential nature of those sort of tier one supports, we call them. So that sort of that focus on how can we bring what's good for one is good for all. And so we have focused, sort of refocused on SEL, which is social emotional learning strategies and competencies, teaching directly how we cope with stress or how we ask for help. We also are really focused on voice and choice, creating opportunities that allow students to have some choice. If they're feeling upset, where can they go and who can they go to? So identifying the people that you feel you have a trusting relationship with. We're also trying to do some prevention. We really want to up our or increase our focus on mental health literacy, having everybody in our district be just much more aware of those signs of emotional distress, as well as peers, and really diving in and giving more space for student voice and peer-to-peer support. We started planting the seeds for that, and we hope to develop that more as we move forward. We're really trying to break down barriers to getting help. So for instance, this year we started having students, with when parents were reaching out and students were saying, can I see my therapist during school? And this is at the high school level, and making room and space for that. If there's telehealth that you can only get an appointment during the school day, what's the priority if that will help? So breaking down those kind of silos and those kind of, we're not a mental health agency, so we don't provide support. This is school. Well, if there's a free period and we can do that and set up the context for that and make it a norm, like it's okay to not be okay. It's okay to be in school, visit with your therapist, and then know who your contact person is after if you need to, and then be able to transition to class. So really kind of saying, what else can we do? What other barriers exist that really are, that we don't have to have, that we can kind of remove those? We've developed partnerships with a partnership with Greater Nashua Mental Health, which is enabling us to have a clinician on site so that we break down that barrier. So basically a co-located service model, it's called. So we are really always trying to work on developing teacher capacity, breaking down barriers. And again, as Kay was saying, like making sure that we are really working toward addressing the stigma. So that certainly does not have to be a barrier.
That is all incredible insight coming from one of our school districts here in the state. So I'm so glad you shared that. And I love that you talked about, the social emotional learning. We have to expand beyond the standard classes that we're teaching and the expectations that they're going to learn math and science. It's those coping skills that you said that you're teaching, the students, and that's so crucial. So like when Natalie, when she surfaced, some concerns that she has, if other students are surfacing those, you're teaching about the coping skills. So that's fantastic. And we'll be sure to have a link to that Nashua Mental Health group as well on the link in our screen. So Kay, turning to you, what advice can you give to parents and other adults who may be worried that, their child may be experiencing a mental health challenge?
Sure. Yeah, I think, it's so wonderful to hear you talk, Fern, about how, the role of schools. I think really schools, being that important kind of touch point and identifier for these problems. But as we also know, parents are the ones who are really living with their children and kind of seeing the day-to-day, well, schools as well, but parents, I think parents struggle sometimes with sort of trying to identify what's going on. And I guess what I would say is, just like we try to observe our kids and understand what might be going on with their physical health, like we notice when kids might not be feeling quite well or more fatigued than they usually are, I think we also can look for those kinds of signs from their mental health, with their mental health as well. So, and some of that has to do with things like, are they getting out of bed? Are they able to sleep? Are they isolating themselves as opposed to being with friends? How are they doing in school? Are they more argumentative and irritable? Sort of, those are some kind of signs that certainly that parents can look for. And then the other piece, and I think Audra, you pointed to this too, is, we've been talking a lot about stigma, and I think it's hard sometimes as a parent to acknowledge that our kids are struggling, right? And I'm a parent as well. So I think I can really understand that it can feel like it's our fault as parents. And what I would just really say to everybody is, again, in the domain of stigma, it's not a parent's fault. It's really, we just need to really be able to help our children, and it's okay not to be okay. And we really want to encourage kids to talk about what's going on with them and seek help if needed.
That's such great information, and I feel it's truly empowering to parents to hear what you just said. So thank you for sharing that. And I love that you just talked about how we, as parents, we check in with our kids all the time. If they're feeling warm, it's like, do you have a fever? I know for myself, did you hydrate enough today? Like, I check in on their water intake. Adding those questions on how they're feeling and the mental questions, just wrapping them in our normal check-ins with them is so simple to do. And hopefully that's maybe one step that us as parents can start adapting. I think that's really great advice. So thank you for that. We're just going to be wrapping up momentarily. So before we do, I want to have each of you touch base on what's one key thing that you want viewers to take away from this conversation. And Natalie, I'm going to start with you.
One key thing I would say is that struggles and challenges in teens with their mental health is a real thing. It does happen, and it happens to a lot of us. So I encourage parents and adults to look for the signs that that we go through, that we're presenting, and so that we can get the help that we need.
Thank you for putting a powerful voice to that, Natalie. You're going to help a lot of kids. Fern, what are your final thoughts?
My final thoughts are, one is that I have to do this, sorry. So my final thought is that mental health takes cultivation and nurturing. It's just like any kind of health. We have to eat well. We're worried about hydration, and mental health is something we can actually be actively pursuing. It's not that you're necessarily born with it. It's something that we have to cultivate, and we can start with ourselves and then offer that modeling to our students and help ourselves develop those really ways to nurture our own mental health. I also just want to say that part of that is learning how we can be listeners to one another, how we can listen and hear each other. Because I think sometimes we get really afraid to even ask the questions or step into those conversations. And that becomes one of our biggest barriers. It's easier to just kind of stay on the surface. And the fact is that sometimes the connection and loneliness those issues can be addressed by just honest communication and really good listening, being, validating what people have to say, really paraphrasing. Even, I think I hear you saying this. Does that sound right? Being curious. What else? How does that affect you? What else is happening in your life? So just learning how to have good conversations. It doesn't have to be about finding solutions and giving resources. Sometimes it can just sort of be about connection. And I think if we could start there, it would make a big difference.
That is so important, because you bring up such a great point. We're trying to empower people to speak up on their mental health, but on the opposite side, we need to make sure we're listening and we know how to listen. So that's such a crucial point. Kay, what are your final thoughts?
So I really just want to add to what Fern and Natalie said, and just, I think we heal through relationships, right? So I think never underestimate your importance as a parent, as a caregiver, as a critical adult in a child or a teen's life, in terms of, listening, caring, kind of what we call holding space for a child or teen in need.
So important. Thank you so much. Thank you, Natalie, Kay, and Fern, for joining us today and sharing your incredible insights on this important topic. So our goal for this webinar series is to help drive the conversation about mental health and to offer mental health and education support. You can view our previous Heads Up segments and access additional information and those resources that we spoke about earlier by visiting the webpage on your screen. Thank you for watching. Stay healthy and stay safe. Take care.